Imagine a silent, invisible threat sweeping across our farms, decimating poultry populations, and potentially setting the stage for a human health crisis. That's the reality of the rapidly spreading bird flu, and the stakes are far higher than just expensive eggs. In the last month alone, outbreaks of the H5N1 virus have forced the destruction of a staggering 3.5 million chickens, turkeys, and ducks. This isn't just an agricultural issue. It's a looming public health concern that demands our attention. But here's where it gets controversial. Some experts are warning that a scaled-back federal response is leaving us dangerously vulnerable. As migratory birds embark on their annual southward journeys, they're unwittingly carrying the H5N1 virus, commonly known as bird flu. This highly contagious virus has been wreaking havoc on poultry farms across the country. According to data from the USDA, 66 poultry flocks have been affected in the past 30 days, resulting in the tragic loss of millions of birds. This represents a significant surge compared to the relatively quieter summer months. The ease with which the virus spreads when infected wild birds mingle with commercial or backyard flocks makes containment a formidable challenge. Currently, states in the heartland of America are bearing the brunt of the outbreaks. However, scientists predict that the virus will likely spread to other regions as bird migration patterns continue. And this is the part most people miss. The consequences extend beyond the economic impact on the poultry industry. Influenza researchers are deeply concerned about a potential repeat of last year's situation, where the U.S. saw nearly 70 human cases, including one fatality. This highlights the potential for the virus to jump from birds to humans, a scenario that could have devastating consequences. Absolutely, we're going to see human infections, just like we did a year ago, warns Seema Lakdawala, a virologist at Emory University specializing in bird flu. Nothing has changed substantially to suggest otherwise. Her statement underscores the urgency of the situation and the need for proactive measures to prevent further outbreaks and potential human infections. While no human cases have been reported since the beginning of this year, scientists tracking the virus express concerns about limited visibility into the situation in both animals and humans. The reason? A reduction in federal surveillance and communication efforts. Wendy Puryear, a virologist at Tufts University, emphasizes the precariousness of the situation. We're not in a great position for monitoring things. I've been deep in the weeds since it arrived here in the U.S., and I'm finding myself in a very uncomfortable place. This lack of comprehensive monitoring hampers our ability to detect and respond to emerging threats effectively. What exactly does this scaled-back federal response entail? According to Puryear, a once robust network of influenza researchers, who maintained constant communication with federal health agencies to discuss research priorities and viral changes, has been significantly weakened. She attributes this decline to staffing cutbacks, early retirements, and other policy changes implemented under the previous administration. In a particularly disheartening anecdote, Puryear recalls a meeting where colleagues announced the suspension of their H5N1 research due to funding cuts. It was a pretty depressing meeting, she says. Just one person after another was closing their doors. This paints a grim picture of the impact of reduced funding on scientific research and our ability to combat the virus. Another critical issue is the slowdown in data coming from the federally run lab responsible for genetic sequencing of viruses collected from infected animals. This delay, which predates the recent government shutdown, further impedes our ability to track the virus's evolution and adapt our response strategies. Dr. Keith Poulsen, who heads the Wisconsin Veterinary Diagnostic Laboratory, points to staff losses at the USDA and the requirement for pre-approved communication with scientists as contributing factors. He argues that these obstacles arise at a time when the risk of spillover from wildlife is increasing, making the situation even more precarious. The government shutdown only serves to exacerbate these existing challenges. And here's a controversial point. Some argue that restricting communication with scientists hinders the free flow of information necessary for effective disease control. Is this a valid concern, or are such measures necessary for maintaining control and accuracy? The shutdown, for instance, led to the cessation of regular meetings among the network of veterinary labs responsible for testing, according to Poulsen. He emphasizes the severe implications of these disruptions. The shutdown just kind of pours gas on a smoldering fire and makes us vulnerable. It's a national security issue. This bold statement underscores the potential for a public health crisis to escalate into a national security threat if not addressed effectively. While the USDA did not respond to requests for comment, a spokesperson for the Department of Health and Human Services asserted that the CDC's influenza team remained unaffected by cutbacks and that responses to urgent public health threats could continue during a shutdown. But does this statement fully address the concerns raised by scientists on the ground? Are existing resources sufficient to effectively monitor and combat the spread of bird flu? Turning our attention to dairy herds, reported data suggests that cases remain relatively rare. A USDA program established during the current administration to detect bird flu in dairy milk is still active, as are regulations mandating cattle testing before interstate movement. However, the extent of routine testing in cattle remains unclear, leading some experts like Lakdawala to speculate that the reported decline in cases may be due to underreporting resulting from a lack of testing. The dairy farm business model, which relies on the movement of cattle between farms, further complicates containment efforts. Recent research from Lakdawala's team paints a concerning picture of the virus's pervasiveness on farms. The study revealed the presence of the virus in the air of milking parlors, on equipment, and even in waste streams used to clean housing facilities. Cows, even those with mild or no symptoms, were found to be expelling it in their milk at such high levels. This widespread contamination creates an environment where cows are constantly exposed to the virus, increasing their likelihood of infection. Fortunately, the circulating strain of H5N1 has not yet undergone the mutations that would enable easy human infection. However, Lakdawala warns that the conditions on infected cattle farms pose a clear risk to workers who are constantly exposed to aerosolized H5N1 particles. In Minnesota, which has experienced about 24 farm outbreaks since mid-September, the state's Department of Health is monitoring approximately 35 exposed individuals for potential symptoms. Karen Martin, an epidemiologist at the department, highlights the importance of maintaining adequate resources to respond to the outbreak. What concerns me is continuing to have the resources to respond to it. We're holding it together right now, she says. A critical aspect of the response is the testing of farm workers, who are at the highest risk of contracting and spreading the virus. Unfortunately, this has been a persistent problem since the beginning of the outbreak. While some human cases have required hospitalization, many have been mild and easily overlooked. A recent paper published by CDC scientists calls for robust data collection of individuals with possible asymptomatic infections to better inform public health responses. A small study from last year uncovered evidence of past bird flu infection in 7% of dairy workers in Michigan and Colorado. However, conducting this type of long-term research requires cooperation from farmers and their workers, many of whom are undocumented. Bethany Bogus-Alcalter with the National Center for Farm Worker Health points out that fears surrounding current immigration enforcement policies make it even more difficult to gain the trust and participation of farm workers. I think it's definitely more intense than it was, and already there was a lot of reluctance to get tested, she says. A survey conducted this fall revealed that many farm workers were too afraid to leave their homes. The survey also showed that about 20% of workers in 3 states experience symptoms concurrently with animal illnesses on their farms, yet most of these individuals were never tested. This highlights a significant gap in our ability to protect the health of vulnerable farm workers. Dr. Nirav Shah, who played a key role in the bird flu response under the previous administration, acknowledges the CDC's decision to downgrade its emergency response. However, he stresses that this should not have impacted the ongoing efforts to monitor the virus and respond to outbreaks on the ground. They are banking on the fact that there might not be anything, but that is a dangerous game to play when it comes to something like pandemic influenza, he says. This highlights the potential risks of complacency in the face of a persistent and evolving threat. So, what do you think? Is the current level of federal response adequate to address the threat of bird flu? Should we be prioritizing increased testing and surveillance, even if it means overcoming challenges related to immigration enforcement and farm worker cooperation? Share your thoughts in the comments below. Let's discuss how we can best protect both our agricultural industry and public health from this evolving threat.